Hey guys, it's Diogo Trevisan passing by today to talk about healthcare. Start understanding a little bit how healthcare is in the United States. You guys know I don't edit my videos. They're not fancy or anything, but to my judgment, they have content. That's what I offer, the content. As a physical therapist, our main source of reimbursement is through insurances. They're not easy to deal with. We've been having some problems as far as denying payment. Insurances are very strong, very individual entities. They just decide to not pay. And then I wanted to know where it's coming from compared to other places on earth and see what the hell's going on with healthcare in the United States. So I'm gonna leave this video, I'm gonna upload to my channel. This is one of many videos that I'm going to be doing. I really want to investigate a little down to the nitty-gritty what's going on and give you guys more details of healthcare in the United States and how it works, the financial aspect. So American healthcare is the most expensive in the world, okay? It occupies a 37th place in quality according to the World Health Organization. So that does not mean the medicine in the United States is 37th in the world as far as knowledge, the quality of the treatment that you get. It's actually one of the best in the world if you have the means to pay for it. So the World Health Organization takes into consideration other criteria. It's as America is a nation, who has access to healthcare, those that don't, how do they get, their treatments, the people that have, like a low income, the cheaper insurances, considering all that. In general, for Americans, it occupies the 37th place in the world, France being the first one. And I'll be talking about France, the system in France, the system of healthcare later on. Medical bills in America are the most common cause of bankruptcy. So the person needs a massive surgery or has an accident, they're stuck with the bill, they don't have insurance, it's gonna affect their credit, they go bankrupt. Okay, that's pretty serious right there. In early 1900s, insurances didn't exist. Remember, doctors were very independent. They used to go to your house. Hospitals obviously existed, but doctors used to go to your house, assess you right there. I mean, people pay them with chickens, type of thing, and literally, and or small amounts of money. The doctor had, the freedom and the flexibility to charge, as much as he wanted at that time. In the 30s, after the Great Depression, hospitals were very empty. It was, as everyone knows, almost like a near collapse in the system. It was really bad. And then hospitals started charging a monthly payment in order to give healthcare, to provide the services. So the idea and, pretty much the first insurance was created at that time through the hospitals. This thing grew out of proportion. Now in America, almost all healthcare, except for Medicare, Medicaid, almost all healthcare is private. And we're talking millions of dollars, if not billions, that these private companies make. And all the strong ones by all the smaller ones, so it's becoming more and more centralized, the power, and they're very independent. So basically there are two types of insurances: health management organizations, they are called HMOs, and preferred provider organizations called PPO. They're not much difference. There's not much difference between one and the other. They're pretty similar, with the exception that people are a little more mad with HMOs because they have a stronger network of practitioners. So the doctor will be in network with insurance, which means he gets paid less money, with the benefit that the insurances will send all the patients to him. I mean, obviously it's not only one doctor, a few doctors, they're in network with that insurance. Say they were not in network, those patients sometimes call their insurance, they're like, where do I go for a specialist? And they don't know where to go. So the advantage of being in network is the insurance will tell you, go with this doctor, Diogo Trevisan. And the price I pay for them sending me all the patients is they pay me less money. Okay. Now another thing is they put a lot of pressure on hospitals, doctors, exams to charge less money. Okay, so they put a lot of pressure in that sense. They also deny laboratory exams. They don't cover contraceptive medication for women, and there's a number of factors that we have to take into consideration. I will be talking more in detail in later videos. So just to give a little, to put in perspective, a private plan to a normal person, whether you make a lot of money or not, you may pay, we'll take as an example the state of Massachusetts. A private plan can cost $700 to a person, and we're talking about like a fairly, acceptable, good plan. But through a big corporation, BJ's, Walmart, it will cost $300. Okay. That encourages big corporations that have thousands of employees, to give insurance to everyone. Okay, and then in turn, insurances, instead of not getting paid anything because these people make $9 an hour, they do get paid, those $300. It's better than nothing. That's how it goes. More volume, more people, and they make less money per person, but they're being guaranteed, thousands of people at the same time. That's the reasoning. So around 1965, Medicaid, Medicare had to be created because insurances were turning down older patients, or they were complaining, they were putting pressure on that as far as reimbursing treatment and stuff, because the older people get, the more they need to go to a doctor, they need treatment, medication, and whatever. And that's when Medicare was created. Now, all the criticism to Medicare, Medicaid is real because they are very limited. For example, they don't cover certain things like acupuncture, preventive medicine and stuff. But not only that, like they'll give you a limited amount of visits, say, you need rehabilitation, in physical therapy, they only give you a limited amount of sessions. And also because in the case of Medicaid, they pay sometimes 1/3 of the cost for the treatment for that patient. So patient goes to the hospital, it takes fluids, injections, doctor, whatever, stay in the hospital and stuff. Medicaid will pay so little that sometimes it doesn't even cover the cost. It only covers 1/3 of what it costs to the hospital to see those patients. So the problem nowadays that created is practitioners that have all the autonomy to choose if they take insurances or not or whatever. They don't. A lot of people don't take Medicaid, Medicare, and these people don't have access to treatment. They don't have the money, and their insurance really can send them anywhere. Now that goes back to the World Health Organization and why we're America's 37th place on earth, as far as quality of healthcare. There's obviously a number of practitioners that take Medicare, Medicaid, and you can imagine what kind of treatment you get, right? If they're getting paid very, very, very little money and they take that money. So a lot of big corporations, are proud to say that they take Medicaid because it's almost like paying back to the American population. They do that of the goodness of their heart. And, or you find out, you know, some people that accept it because really the quality that they give is not great. So Medicare collects money from your paycheck from the moment you start working and invest the money in a trust fund. Okay, now another critic to Medicare is that when you add up the numbers, the government never spends the money back on you. So in the end, when people need that, what they paid for, Medicare does not invest that money back. So let me know what you think. Let me know your doubts. Give me ideas. I am going to compare healthcare to other parts of the world. Talk a little more, you know, about insurances, how, you know, the authorizations work and the reimbursement, the system. And I hope in a later video to finish with my own personal opinion about the solution, you know, to this problem that will benefit people and the economy. Let me know what you think. If you want to see the continuation, the other videos, give your like to this video, subscribe to my channel. It's mainly an orthopedics channel, but I'm going to do this series of videos explaining healthcare because I find of very, 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 very important. Okay? Thank you, guys.